It's my absolute pleasure and delight to invite now to the podium Emma Harper, M.S.P in the southwest of Scotland, who has been a champion right from the very start. I won't repeat my introduction, you've already heard it. Emma, I'm delighted to welcome you now to the stage. Thank you.
I don't need slides. Thanks. Thank you, John. It's great actually to be here in person. You know, we've been doing all our cross-party group meetings online, virtually, which is great because it means people from Shetland can attend, and Western Isles, and all the way down to Stranraer as well. But I'm really pleased to be here today, and thank you, John, for inviting me to attend the Dissemination event for the Breath Project and for asking me to address you all this afternoon. And it's actually really good to see Martin looking so well. I've met Martin a few times because he was one of Phyllis's patients, and so we've had a chance to see him at the cross-party group as well, in person before COVID as well. So the Breath Project, the Border and Regions Airways Training Hub, it has been an ambitious collaborative research partnership, and the success is so apparent here today. You know, the partnership, the enthusiasm is in bucket loads, I see, especially with the engagement with the school children. And this partnership has it's harnessed complementary resources and the expertise of 10 principal investigators from the Dundalk Institute of Technology, the University of West of Scotland, and the Queen's University in Belfast. And when I launched the Breath Project back in 2017, 5 years ago, at the Crichton campus, where I trained as a nurse in Dumfries, we heard how the project had a mission to tackle chronic obstructive pulmonary disease. And it's highly prevalent in the border regions of Ireland and the west of Scotland, as John has highlighted with the maps that he's shown. And over the course of the project, it has been supported by €7.7 million of funding, but 8.9 in total, as Professor Thornbury has actually noted, and the European Union's Interreg VA programme is responsible for that. The programme truly has been a pioneering cross-border research project designed to better understand and alleviate the impact of COPD. And tackling respiratory ill health in Scotland, it costs £1.2 billion each year. So I think it is, we are required to invest in it so that we can look at prevention and then focus our funds elsewhere. The researchers and the staff involved with the Breath Project have worked extremely hard to meet the objectives, and I want to pay tribute to every single person who has been involved, including our researchers, our clinicians, our patients, and the wider community who have supported it. This included many schools across my South Scotland region, such as Kirkcudbright Primary, Douglas Stewart High School in Newton Stewart, Melrose Primary, and Belmont Primary School in Stranraer, and many, many more. Stranraer is my hometown, so it's really good for me to see what has taken place in the southwest of Scotland. It is clear that the project has had an important focus on education and outreach, which, as a former clinical nurse, I was a former clinical nurse educator, I absolutely hugely value and appreciate education that's taken forward. Respiratory health is of great importance to me, and prior to my election to the Scottish Parliament in 2016, I did practice as a nurse for 30 years in Scotland, in Surrey and in Los Angeles. And my big sister, who some of you will know, Phyllis Murphy, she is now Dr. Phyllis Murphy. She is a respiratory nurse consultant, and she was instrumental in helping me to raise awareness of respiratory health in the Scottish Parliament. It was Phyllis who helped me to establish the cross-party group on lung health, which I now co-convene. And we kicked that off probably a good 5-6 years ago now. And my big sister obviously has a knack for coercing her wee sister into action. So this was the first cross-party group anywhere in the UK with a focus on the broader subject of respiratory health rather than focusing on ill health. And indeed, Professor Lockhart has presented and participated at the CPG on many occasions, and I know how valuable Dr Lockhart's contribution has been to the cross-party group and in helping to shape questions of the Scottish Government and correspondence to the Scottish Government. And I look forward to John coming to present with colleagues, albeit virtually, at any upcoming cross-party group. I think we'll need to arrange dates soon for that. It's also really been important for me to look at how we help progress and shape the Scottish Government's Respiratory Care Action Plan. And we know that many people living with a respiratory condition, they're not able to work, to study, to drive or live independently. And in Scotland, respiratory conditions account for over a third of all acute hospital admissions and are also one of the most commonly presented conditions within primary care. And early in 2020, clinicians were faced with a new challenge of COVID-19. And of course, the main target of this virus is the lungs. And many respiratory doctors and nurses and allied health professionals, they were redeployed into frontline COVID-19 wards to treat people with severe infections. This obviously had an impact on service delivery. And every winter, people living with respiratory illness such as asthma, COPD or bronchiectasis, they tried to protect themselves from the flu virus. But in 2020 and 2021, people living with these conditions protected themselves and others from this new virus by shielding. There's a new word that came into our medical vocabulary. And we know that this physical and mental toll of shielding has been significant for people living with respiratory illnesses, and I welcome that the Scottish Government is therefore committed to improving access to rehabilitation services and mental health support. We're always talking about mental health these days. It comes up. I'm a member of the Health and Sport Committee as well, and it's on the tip of our tongue every time we take evidence sessions. And the Respiratory Care Action Plan for Scotland, it was published last year. It identifies key priorities and commitments to improve outcomes for people living with respiratory conditions in Scotland. The plan encourages new and innovative approaches and intends to share best practice. It sets out Scotland's desire to see a whole system approach to respiratory care across health and social care, and the Scottish Government's priorities and commitments will build on the progress that has been made to date. To deliver the most effective person-centred care plan, we need to set out what the Scottish Government's commitment is to work collaboratively with key stakeholders in the implementation of respiratory priorities. So this is with the aim of designing and developing services that meet the needs of everyone, with a focus on those especially experiencing health inequalities. So how is this achieved? Well, the ageing population and advances in primary and secondary diagnosis of cardiovascular diseases and improvements in acute and chronic management for respiratory complaints means the pressures placed on secondary care respiratory units are far greater than ever before. And ensuring people see the right healthcare professional in the right setting at the right time continues to be demanding. But this is key to reducing prevalence and exacerbation of respiratory illnesses. Challenges of prioritisation of the people with serious illnesses, providing access to diagnostic testing to allow primary care clinicians to make independent decisions with their patients, streamlining referral pathways to ensure those with the greatest need are seen quickest, and providing high-quality ongoing care for people with chronic respiratory disease. So these are key tenets of the Scottish Government's Respiratory Care Action Plan, and that is being led by Dr Tom Farden from NHS Tayside. Tom is a respiratory physician, and he comes to a cross-party group quite often, actually, and he gives up his time in order to help promote the best action that he can help support to take forward. So we've got many organisations across the UK that are seeing that the Respiratory Care Action Plan is seen as setting the gold standard in respiratory health management. And it's important, I see, that we don't downplay COVID-19 and the way it has changed respiratory clinicians' work. The effects of these changes will be felt for years, and in many respects, respiratory medicine and the patient experience will never be the same again. It is essential that we recognise the effects of COVID-19 on the people who were infected, those whose disease management was altered due to the pandemic, both directly and indirectly, and those who will develop new chronic symptoms or have worsening of their underlying condition due to infection. However, there have been improvements to the services due to the COVID pandemic, increased use of remote consultations, and it has improved access to clinical care, and it's reduced the burdens of travel, which has reduced emissions, which hopefully in the end up will improve our air quality as well. It's also released clinicians from the constraints of clinical space as well, and indeed closer working between primary and secondary care. Between the teams, it has helped provided joined up care during the patient journey and has been welcomed and has increased awareness of infection control measures in the community actually. But I know that we do need to still encourage, hand washing, wearing of masks if people choose to do so, and that whole infection control measures to help protect us as we move forward. So we have seen a reduction in the incidence of viral and bacterial respiratory illnesses dramatically in 2020 and 2021. But however, critical services such as face-to-face pulmonary rehabilitation classes have been severely limited due to social distancing guidelines. It's an issue which is now being addressed with utmost priority, and we're now even seeing pulmonary rehab being delivered using telemedicine means, so that is being measured locally, I know, in Dumfries and Galloway as well. The respiratory conditions addressed in the Scottish Government's Respiratory Action Plan, asthma, COPD, idiopathic pulmonary fibrosis, bronchiectasis and obstructive sleep apnea syndrome, they make up the majority of the workload of respiratory physicians in Scotland. And although each presents its own challenges, there are problems that are common to all respiratory conditions. There is a strong evidence base for these conditions and straightforward measures that can be taken to improve outcomes. Investment in respiratory medicine has never been as important as it is now, and provision of high-quality, joined-up respiratory care across Scotland and indeed across the UK and here in the EU must now be the priority. New investment in well-trained multidisciplinary healthcare teams is critical, and this is why the work of the Breath project has been so important. Breath has successfully trained 28 young scientists to PhD level or beyond in both project-specific scientific skills, as we're heard, and as we're going to hear some more, through industrial interactions in transferable and complementary industry-relevant skills. Many of these skilled scientists have progressed into high-level jobs in industry and academia within this border region's area hub region and beyond. Breath has active collaborations with 3 industrial partners and have engaged with another 16 local and international companies over the course of the project. To date, the project has produced nearly 80 conference presentations and research papers, most of which have cross-border authorship. Breath also have an extensive public outreach programme, as John has just presented, consisting of multimedia events through which the project has actively engaged in over 5,000 pupils to date across the project's areas. This dissemination event here today is highlighting the success of Breath across all fronts. And including, I have been particularly impressed by the biographies of all the researchers who state how the Breath project has helped them to advance their careers. Doctors Dudham, Mullins, PhD students Talene Al-Kawadri, Ritu Dwivedi, make sure I get names right, Ruth Matthews, Leanne Morgan, Emma Carroll, Kimberly Black, and all other researchers and students. They must be recognised for their hard work and their dedication. So I want to conclude my remarks by again thanking everybody involved in the Breath project. I know we're not done yet. I know we need to continue to do the work, and I want to thank you all for helping to shine a big bright light on the prevalence of respiratory conditions across the southwest of Scotland and Ireland, and for playing your part in helping shape the Scottish Government's Respiratory Care Action Plan. I'm proud of the progress that's been made, and I hope that we can share experiences to see the outcome for those with respiratory conditions continue to improve. So once again, everybody, thank you all, and thanks again for inviting me here today. Thanks.